a minute. We need- Good morning. Today is Tuesday, March the 3rd, 2026. Today is actually our final calendar for the TennCare Subcommittee. And so I called the meeting to order. And at this time, I'm going to call on Representative Love to lead us in prayer and the pledge this morning. Representative Love.
Thank you, Chairman. Let us pray. God, we thank you for this day's rising up, this day's going out. We thank you, Lord, for the chance to gather as we conduct the business of this state. God, bless those who are in attendance, bless those who are traveling, and give them traveling mercies is our prayer. Allow those, God, who are in the process of trying to get here to arrive safely. Bless us, O Lord, is our prayer in your name. Amen.
Amen.
Let's pledge allegiance to the flag. Pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right. Madam Clerk, if you would open where we could take the roll, please. We will give some folks just a minute. All right. Madam Clerk, will you take the roll, please?
Mr. Chair, you have 6 members present. You have a quorum.
All right. Thank you. Do we have any personal orders this morning? Chair Lady Moody.
Thank you. I see so many wonderful people in the audience that we desperately need, and glad you're here. But my Covington Police Chief is here, Donna Turner. Will you wave and thank you, and God bless you all and all that you do.
All right. Representative Love.
Thank you, Mr. Chairman. Certainly want to recognize that I think we have a good number of doctors and also medical students who are out in the hallway and some in here with us. So I want to certainly recognize them and thank them for their service.
All right. Any other personal orders? Representative Parkinson.
Thank you, Mr. Chairman. I want to recognize our Chair of Finance, Chairman Gary Hicks.
Oh, yeah.
Boy, you talking about putting it on, right? Yeah. Anyone else? All right. Well, we've got, looks like we've got about 6 bills this morning, so we're going to go ahead and get started. So our first bill is House Bill 1864 by our Chairman Gary Hicks. You have a motion and second, sir.
Thank you, Mr. Chairman.
And I believe you've got an amendment. Is
Yes,
that
sir.
right? Okay. That would be 014398.
Make sure that is the correct one. Mr. Chairman, I think the one I'm going to go with is actually going to be 11917.
Give us just a minute.
Okay. Yeah, we're going to hold off on that amendment right now. So the bill's in proper format.
Okay. You're recognized, sir.
All right. Thank you very much, members. This is the annual nursing home bed assessment, and this will renew for 1 year.
Okay. All right. Appreciate that. Anybody, any questions, any comments? Question has been called. So if the clerk would open the board for us to vote. If you would take the vote for us, clerk.
Mr. Chair, you have 5 ayes and no
Oh.
nays.
All right. House Bill 1864, Chairman moves on to insurance full.
Great. Thank you.
Next, again, is Chairman Hicks with HB 1867. Do I have a motion and second? Motion and second. I do see that we have an amendment on this one also.
Yes, you want, I have 013417.
That's what we have.
All right.
Yes,
Sorry
sir.
about that mix up a few minutes ago.
That's fine. That is fine. All right. Do I have a motion and second on the amendment? Motion and second on the amendment. All in favor, aye. Any opposed? All right. So the amendment is added on. And so if you will share with us about HB 1867.
All right. Thank you, Chairman and members. This is the annual hospital assessment that we pass each year.
All right. Thank you for that explanation. Any questions? Any comments? Seeing none, if there's no objection to the question, we're going to vote. So, Madam Clerk, if you will open the board for us, please. Madam Clerk, would you give us the vote?
Mr. Chair, you have 5 ayes and no nays.
All right. House Bill 1867 moves on to full insurance.
All right. Thank you,
Thank
Chairman.
you,
and members. Thank you.
All right. Next, standing in the back is our sub-chair, Chairman Ryan Williams with HB 2046. Do I have a motion and a second? Motion and a second. Sir, I don't see any amendments on this. So we are ready for House Bill 2046.
Thank you, Chairman and members. For the first time this year, I think we got the original draft correct. But what this bill, TennCare's reimbursement rates for physicians, as you know, Chairman and members, and physician assistants and advanced practice nurses remain significantly below those of Medicare and commercial payers, creating a persistent payment gap that threatens to healthcare across the state for all Tennesseans. This disparity is particularly harmful in essence of such certain areas such as primary care, behavioral health, and maternal care, services that are foundational to community health services in our rural areas of the state. These low TennCare reimbursement rates are a major deterrent in attracting a new generation of physicians to rural areas. We found this out through the Rural Health Transformation Act and that $1 billion we hope to spend in rural Tennessee, especially for those career physicians like Dr. Hudson in my district, who has been practicing for more than 45 years in my community, and the promise of healthcare wasn't what it used to be. Without competitive rates, rural areas will struggle to fill these gaps and further weaken the healthcare system. Fortunately, funding sources do exist to address these payment gaps. In 2025, Tennessee implemented the Hospital Investment Program to increase hospital-directed payments to approximately $2.5 billion. The program has generated significant additional tax revenue to the state, nearly $150 million through existing MCO tax. This new tax revenue directly benefits the state's general fund and can be leveraged towards increasing provider rates to close the gaps across our state. This strategic investment will help create and increase patient access, improve workforce stability, and promote long-term economic growth. With that, Chairman and members, I'm happy to answer any questions the members might have.
All right. Thank you, Chairman Williams. And I want to say, we heard a lot of discussion about this as we went through budget hearings with TennCare, and it was just on and on the issue of the rates and making sure that these primary care physicians are they're losing money taking care of our Tennesseans. And so to make sure that we're doing the best we can by those providers, and I certainly appreciate this. So Representative Parkinson, you're recognized, sir.
Thank you, Mr. Chair. I just want to echo your words. Chairman Williams, I appreciate you bringing this bill because I've heard from some of our doctors in my community for the last several years about, the reimbursement rate and how we were treating our medical professionals. So thank you again for bringing this.
All right. Anyone else? Representative Sparks, you're recognized.
Yeah, I just want to echo Representative Parkinson. I said we have some healthcare folks here. I'm in a city. I'm 2 miles from a hospital, 5 miles, 6 miles from another hospital. You have a passion for rural healthcare. Can you expand on that a little bit and why it matters so much to you, Chairman?
Chairman Williams, you're recognized.
Thank you, Chairman. Yes, Chairman Sparks. The issue has evolved such that, particularly in rural areas in Tennessee, the payer mix has become so weighted towards public pay insurance that the promise of healthcare just doesn't exist like it once did. And so when reimbursement rates for the same care in a metropolitan area or a large hospital chain might generate a higher reimbursement rate, those reimbursement rates are much higher for private insurance than they are for TennCare Medicaid users here in the state. And so when that payer mix is unevenly weighted, what ends up happening is that a lot of our even general practitioners turn into charitable care organizations, much like they'd seek charity care because they're simply living off the private pay insurers. And so what this would do, it would take revenue from the MCO tax and direct it through TennCare to direct provider payments to help increase the rates, since they've been woefully inadequate for more than 2 decades.
Sure. When you talk about that, I think I went to visit with some physicians, and they're looking at like 75% of their patients, and a lot of times in rural Tennessee especially, are Medicaid, TennCare, and so any way we can boost that is a plus. So again, I thank you for this bill and thank you for the work in this. Any other questions or comments? Chairman Kumar, you recognized.
I just wanted to reinforce the sentiment of the committee that this is important work as far as patient care is concerned, and these healthcare workers are giving it their all, and they certainly deserve better. For a long time, the feeling was that this is a mission, which of course healthcare is a mission, and these healthcare providers are doing God's work, and they still are, but they need to be duly rewarded. And thank you for bringing this.
Thank you.
Any response? Good. All right. Any other comments? If not, I think we're ready to vote. So, Madam Clerk, if you would open the board for us. Would you take the vote?
Mr. Chair, you have 5 ayes and no nays.
All right. Chairman Williams, House Bill 2046 moves on to full insurance.
Thank you, Chairman and members.
Thank you. There he is. Next is HB 2097 by Representative Reedy. You have a motion and a second. I don't see any amendments on this, so.
No, Mr. Chairman, and Mr. Chairman, you and I were honored today to have the ambulance service members with us today in this room as well as out in the hallway. And I hope that you were able to make the breakfast first thing this morning on the 8th floor. But this is my annual pilgrimage to this committee to get the extension done on the ambulance service assessment extension, Mr. Chairman. And I'll read into the record. The ground ambulance assessment was created in 2018 to help fill the gap between the expenses incurred by ambulance services to perform a transport and what Medicaid reimbursements for this transport. Without using any state dollars, the ground ambulance service pays into a fund that draws down over $20 million in federal funds that is then paid back out to these services based on the Medicaid transport. House Bill 2097 will extend the ground ambulance assessment for another year. The one change, this bill also includes a change requested by TennCare that would more properly penalize service for delinquent payments. The change is from $50 per calendar day to 5% of the principal per month. Mr. Chairman.
All right, thank you, Chairman Reedy, for that explanation. I think we have one to ask questions. Chairman Sapiki, you are recognized, sir.
Thank you, Mr. Chairman. Question on the bill.
Question has been called, so Madam Clerk, if you would open the board for us, please. All right, would you take the roll or take the vote for us, please?
Mr. Chair, you have 7 ayes and no nays.
All right. Chairman Reedy, House Bill 2097 moves on to insurance full. Thank you, sir. All right, next would be item number 5, which is House Bill 2457. And the sponsor, Representative Harris, has asked for this to be taken off notice. So we will take House Bill 2457 off notice. Last but certainly not least, the new Gigi around here, Representative Renee Jones, House Bill 2411. Do we have a motion and a second? All right, we have a motion and a second. I see you have an amendment 013459. Is that correct?
Yes, sir.
Okay. Do I have a motion and a second for the amendment? Second. Motion and a second. All in favor, aye. Any opposed? All right. So the amendment is added. So, Ms. Jones, if you will explain your bill for us, please.
Thank you, Mr. Chairman. What this bill does is it will add a total of 4 members to the council, which would consist of 1 TennCare employee and 3 representatives from each of the 3 MCOs. The reason we're doing this is that as TennCare becomes more engaged in managing and providing care for those with intellectual and developmental disabilities through the Choices program. We believe that this is important for TennCare Bureau Long-Term Services and Supports, as well as representative TennCare MCOs, to be a part of the council's deliberations, to hear the real stories firsthand from the patients and the advocates. So for that, I'll stand with questions.
All right, Representative Jones, I want to say thank you. This is a bill that would be a fair representation of the 3 MCOs and basically that everyone would have a seat at the table that's
Yes.
involved. So
Yes, Mr. Chair.
thank you so much for this piece of legislation. Any other comments? Any questions? See no questions? If there's no objection to the question, we will now vote. Madam Clerk, if you will open the board for us, please. All right, will you take the vote?
Mr. Chair, you have 6 ayes and no nays.
All right, Representative Jones, House Bill 2411 moves on to insurance full.
Thank you, Chairman and committee. Thank you.
Thank you. Well, this comes to the close of the TennCare Subcommittee, and I want to personally say a couple of thank yous. First of all, to the Speaker for the opportunity and the trust of serving as the chair for the TennCare Committee for the 114th General Assembly. Each member that served on here, it's been an honor to work with y'all and to have y'all to serve on the committee. To Lovin, to my left, to Ryan, to my assistant, Jax, to Ruben, our sergeant at arms, to the clerk, to the TennCare staff. Director Smith and his team have been, Ashley and them have been wonderful. And so I just want to say it's been an honor to serve as the chair this year, for this session, the last 2 years. And so does anyone have any other personal orders or anything? Okay. Chairman or Representative Sparks? Oh, I'm sorry. Parkson. I'm sorry.
Point of order, Mr. Chair. Point of
I
order.
am so sorry. I wouldn't do that to you for nothing in the world. I am
Point
sorry.
of
Representative
order.
Parkson, please forgive me.
Now, Mr. Chair, I had nice words for you, good, kind words for you. Right? It's one thing to be called Hardaway, and then another thing to be called Representative Sparks.
Bless your heart. I'm sorry.
Right. But no, honestly, Mr. Chair, I just want to tell you how much I appreciate your leadership in this committee and how you've led over the last couple of years. And I think you were built for it. And so I truly appreciate you and thank you. I'm honored to be serving on this committee. Thank you so much.
Thank you so much, Representative Parkson. Anyone? Now, Representative Sparks, here we go.
Parks and I do look alike. We have a lot of similarities. No, I want to recognize the chairman too. Chairman, I appreciate your heart for people. This is a tough committee. You want to support everything you can, but sometimes you can't. But I want to recognize my intern if he can wheel himself up here. Come up here, Jacob. Jacob, come on up all the way if that's okay, Chairman. He's been an awesome intern, Jacob. I always get his last name mixed up. It's Jacob Pagel, like bagel. So it's Jacob Pagel. Bagel. Anyways, I get it mixed up. I have to work on it, but nothing gets this guy down. He's just wheeling himself around here and just doing such a great job with the hardship he's had. I've seen him take the steps at the radio station that I do. He's got the little hand walkers and don't let nothing get him down. So y'all make him feel welcome here.
Thank you. I appreciate the friendship with Jacob also, Representative Sparks. Representative Love, you're recognized, sir.
Thank you, Mr. Chairman, and I echo the sentiments of my colleagues. To have you lead TennCare Subcommittee has been great, and we're grateful for your leadership and for the staff that makes sure that we have everything we need for the committee. And just to say for these students and professionals that are here, as we deliberate these bills, talking about reimbursement rates and we talk about the importance of insurance, this is what we do. And to have great leadership like our chairman is helpful because we get a chance to actually debate the bills and then vote up or down and see if they go to full insurance committee. So again, Mr. Chairman, thank you for setting a great example for these visitors to see how we conduct our committee. So thank you, Mr. Chairman, again.
Thank you, Representative Love. Anyone else? Chair Lady Moody.
I would just like to say, Mr. Chairman, that I also appreciate it. Having not ever served in the health world and TennCare insurance, all these things, certainly know about them, but personally. But thank you for your guidance and instructions and just guiding us through some things that maybe are not as clear or understandable as others. And that we do pray that we have offered good legislation. And it is hard sometimes to say no, but that doesn't always mean a permanent no. So don't give up, right? So thank y'all for being here today. And thank you. It's been an honor to serve under you. Thank you.
Thank you, Chair Lady Moody. We celebrate you. You're going to be retiring on us this year, and you're going to be a miss to us. And the asset of you and your leadership and what you have meant to the General Assembly, and we treasure you and what you've stood for. So thank you so much. There you go. Chairman Kumar, you're recognized, sir.
Thank you, Mr. Chairman. Again, on behalf of all our committee members and myself, congratulations for a successful session. And we have enjoyed working with you. You bring a unique perspective and good cheer. Thank you.
Thank you so much. I appreciate it. And to each one of you that are here today, our emergency EMS directors, our students, our physicians, thank y'all for what you do and for being a voice, representing a lot of other people. You know, that's how government works, is for y'all to come and to share your insights and your thoughts. We can't know everything about everything. And so having you to be a voice. And so thank you for showing up and for being that voice and for what you do. Because none of this that we do, folks, is about us. And it's not about you. It's about the 10,000 or the 7 million people that calls Tennessee home. Each one of us represent roughly about 70,000 people. But ultimately, it's about the 7 million that call Tennessee home. And we want to do the very best we can for each one of those. And so with that being said, without anything else, we will adjourn subject to the call of the chair.